Hey, I'm Kayla.
And I'm Stephanie, and this is the Chaos Chronicles.
Life's messy, weird, and totally unpredictable.
And we are here to talk about all of it. No filters, no fake perfect lives, just pure, unhinged, glorious chaos.
So grab a drink.
And let's dive right in.
On today's episode, Stephanie learns how to drink. Apparently, drinking from a can is very difficult.
You gotta swallow it.
You apparently gotta keep your mouth on the can to drink the drink. Otherwise, it spills all over your shirt.
Hey, I got it on my face, not my shirt.
Otherwise,
right.
you spill your drink all on your face.
No comment. All right.
And on that note,
quick blooper. Quick
now
bloopers.
I'm going to be the one who has issues drinking.
Okay. Would you rather ER edition?
All right.
Would you rather
Our mini episode.
I know, right? Ours are 2.5 or 3.5. Would you rather deal with a patient with bed bugs or
I had a
GI
bubble.
bleed?
I hate GI bleeds.
You can smell them.
I-
It's like that C. diff smell. You can tell exactly what smell it is.
I can smell it now.
What?
But bed bugs just get I would rather peppermint oil, toothpaste.
That's not enough to get rid of the GI
and
smell.
I would rather GIs.
I mean,
But
so
bed
would I,
bugs.
but
And then bed bugs get on you, and then they crawl, and then they stay, and then you take them home, and then you're in your car, and they're just everywhere.
you can put the little doggy.
I can at least, yes, but I don't get to
worth
take
it.
the little doggy home.
That's fair. That's fair.
For those who don't know, there's the bed bug sniffing dogs that come to the hospital when there's a bed bug exposure.
Yeah.
Try saying that 5 times fast.
No, I'm good.
And they come after the procedure to make sure that all the bed bugs are gone. You get to pet the doggy, but you don't get to keep it.
He's a little Jack Russell Terrier. I can't remember his name, though.
I don't remember either.
Because there's only one in Northern Virginia, I think.
Probably. No, I would rather 100%.
Yeah, bed bugs. Or my GI
No,
bleed.
GI
I know, that's what I
bleed.
meant. Oh my god, yeah.
There was a reason I have 2 things of peppermint oil, one in my bag, one in my pocket at all times.
Just put it in through like a neb treatment, like aerosolize it and walk around the department.
Or I can do what?
Coffee. We did coffee one day and made everything kind of brownish.
It made us
color.
all really hungry, thirsty.
Yeah, me too.
Were you there the day that I handed the peppermint oil to one of the APPs, and she had been off for a while, so she absentmindedly, it's like in a little container, and it has a top, and it's got the oil inside.
Yeah.
You just kind of flip it over, you put it wherever. She put it on like perfume, and I was like, how is that going to help your fecal decompaction you're going to go do?
Oh, God. That's so cute.
Let's re-talk about this.
You're like, let's reassess
Hey.
the situation. Maybe under the nose or in the mask.
Something.
Double mask with toothpaste in the middle.
Exactly. Nope, would rather.
Yeah,
That's a hard one, but I'd rather GI.
Oh, I'll take the GI bleed
bleed.
any day over bed bugs. That was like not a hard decision for me. GI bleed.
Ugh, no, the smell. I've had some really bad patients with GI bleeds, though. That's probably why.
Yeah,
Second guess.
I had one code,
Yeah.
and every time we compressed, you know where I'm going with that one.
Yeah. Next, what's the next one?
I don't know.
Oh, I thought you had the list.
I don't have a list. I was just coming up with these on my
off
own.
the top of your head?
Yeah, yeah,
Oh.
yeah. Would you rather?
Combative drunk
Or
combative psych?
one of them was
Or
my
just
previous
normal
relationship.
psych.
So,
Aww.
how's
How's your hand?
This finger still gets numb on this side. And I can't reach across to text with my cell phone because I can still feel it pull in here.
So what
But
I'm
that's a
hearing
different
is
story.
you can't do the flippy thingy.
I can't flip. I can't do the flip.
I struggle with it apparently too.
I think I would rather take. Oh, that's a good one. Combative psych.
Really?
Yeah. Only because we can drug them up and knock them out. Combative drunks, it's harder to do that too.
Yeah.
It takes a lot more. Where I feel like most of the time combative psychs, they are combative and crazy like that because they've been off their meds for so long that they
And
you just not
rug
just
'em up.
B-52 them, and
You can't be 52. It's chemical restraint.
it's
You can only
warranted.
B5 or 5'2" or B2. You
Geodon.
can't all three of them.
Just geodon them.
Okay. All right. No,
You can't fight if you're
Yeah.
sedated and intubated. That's all I'm saying.
I think just psychs are more. I regret saying this now. It's just more fun than most of the drunks that we
Most of
see.
the drunks that we see, because God, the crying and whining, and then the anger, just like
Yeah.
ugh.
And you're
With
just gonna
psych,
be
a lot of
like,
times they can't help it.
You're
With
just gonna be
drunks,
like,
it's because they're just
why?
angry,
"What? Be a happy drunk.
like me.
Yes, like you.
I'm sober
Don't-
right now, by the way. Okay, guys.
I know we
I
haven't
was
even.
not
we
at
haven't
lunchtime. I had some
busted.
prosecco earlier.
Oh, that's rude.
Marketing meetings, man. They're the
Yeah.
best.
You went to a fun prosecco lunch. I was studying. That's rude.
Hey, I'm sorry. Then I got a nap after. It was great.
Oh, I know the answer to this one.
Okay, what you got?
All right. Would you rather work a night shift with your favorite coworker, but be understaffed by 2 nurses, or day shift with a full staff, but none of your favorite coworkers?
I would rather work night shift any day.
I know.
Only because A, it's night shift. B, now I don't.
Okay, well then let's flip it around then. Would you rather day shift with your favorite coworker and understaffed, or night shift fully staffed with none of your favorite coworkers?
See, this is.
Because I know you're thinking day shift is admin and all of the extra.
Wait, is it a weekend?
No,
Damn.
it's a weekday, not a holiday, and everybody is there. But the kitchen is closed. The cafeteria is closed.
Cafeteria is always closed.
I know.
What are you talking about?
I didn't
It
want you
always
to get
closes.
hopes up that you're like, oh, day shift, cafeteria's open.
Day shift, I know, right? Morning. Ooh, that would be great. I'd get my morning biscuits and gravy again. That was the only perk.
Chick-fil-A minis.
You know, the one time I worked a day shift for Tommy.
Get Chick-fil-A to bring back Chick-fil-A minis all day.
That'd be nice.
Yeah. All right, we'll work on that. That's our
This
next
was
marketing
supposed
project.
to, right? This was supposed to be a quick little thingy.
I know.
When the squirrels got loose
Squirrels.
again.
No,
Okay.
this might be a full episode now.
I honestly, I think I would rather. Oh God, day shift's a whole different ball game. And you said we're short 2 nurses.
We're short 2 nurses.
Mm.
We only have our 3 day shift nurses. It's you, me, and someone we mostly like,
Someone, oh God,
who's a decent worker,
probably.
but not a bestie.
No, that's fine. I can. Probably
Boring.
day shift, because if it's going to be a living hell, I'd rather be in living hell with other people I like. But at the same time, like, night shift, I don't have the admin. And I feel like on night shift, we're short staffed anyways, because at least during day shift, we have like the directors and stuff who come on the floor to help.
Tommy's not able to come and help. He's stuck in
God.
meetings all day.
Why are you just putting me in purgatory?
And our nursing soup is not a helpful nursing soup.
Oh,
It's just an okay nursing soup.
that's.
Now I'm just making this. You're never gonna pick working with.
I already said day shift with people that I like. Ugh. I almost threw you guys under the bus and be like, "Fuck, it's night shift all the way." Wait, day shift, or like a mid shift day shift?
No, we'll do day shift. Day shift.
So I'm bitchy aunt because I don't do mornings.
Yes, but you get to get off at a good time, and you have people relieving you, and you know you're leaving at 12 hours.
Ooh, and it's
not-
day shift, so I'm guaranteed a lunch.
Yes.
Because you know us mid shifters, they forget
Never
about us.
get a lunch, and we never get off on time. So yes, it's a day shift. You actually work a 12-hour shift and not 14,
Day
and
shift.
you get a lunch.
Day
Yeah.
shift with lunch, yeah, with a lunch. Yep.
Mm.
Let's see here. Would you rather?
This is the gross and graphic section.
Ooh, yeah. What do we got there?
I like that. Would you rather assist with a maggot-infested wound or a live birth in the waiting room?
Live birth in the waiting room.
100%.
Live birth. I've done those so many times,
Yeah.
especially during COVID, because people were like, they wouldn't let like the support person or the spouse in, so they had to like essentially labor and deliver by themselves. They would always wait till the last minute. And do you know how many babies I've delivered in a car?
Probably about as many as I have.
Probably.
Yeah.
but I didn't work EMS.
That's valid.
We had to have like a special training on this is how you properly deliver a baby. I was like, cool, can you show us how to do it in a car?
Yeah, right.
Had so many babies delivered in a car.
Yeah.
But yeah,
Lots of
hands down,
cars.
I'd rather deliver a baby than dealing with maggot
Maggots.
infested. Although I've done that too. We
Yeah.
had to put her in the decon room and take the hose.
I had a patient come in and he's like, my foot is hurting. I looked at his foot. Saw this patient a week before. Perfectly fine. And I was like, well, why is your foot hurting? He's like, my shoes aren't fitting right. Okay. Take a look at his foot. It's wrapped in a plastic bag.
Is it catching all the maggots?
I should have known, but I was young and naive and
How to be a young dumb
inexperienced.
nurse again.
I
This is why we're
unwrapped it.
jaded. No, no.
No, this was in the ambulance too.
Oh.
Things flew out of that plastic bag.
Oh, how long were you guys cleaning that rig?
Not. I'm not gonna lie. My partner said, "You're dealing with this patient now, and you have to deal with him and go in the hospital." And he spent a while cleaning, and we were stuck inside handing over care for a while. So
That's gross.
it was a while.
Yeah, no. Give me my labor in the
Yeah.
the lobby any day.
100%. Oh yeah,
Catch babies all day, every day.
right. We should. That's what we should do.
Go to L&D.
No, we can't do
Oh.
L&D.
I
in
can't do that
general.
up at that hospital.
No. Most of them, every hospital, they're all clicky, catty.
I worked at no, when I was at the other hospital before Fairfax, the L&D nurses were actually really sweet.
Oh, well, I'd go work there then.
I used to teach newborn IV courses with them.
Oh,
Yeah,
that'd be fun.
it was. It was a lot of fun. But yeah, they were nice.
Pull a Foley from a combative patient or pack a wound on a flirtatious one.
It depends. Is the flirtatious one cute and are they rich?
I was like,
Well, hold on here.
I was
All
like,
right.
honestly, at some point in time, it doesn't even need to be cute or age appropriate. We were talking about sugar daddies recently.
I mean, that's fair. Sugar daddy, that's yours. I think that's yours.
No,
I
it's
don't
too straight. It has to be your
know.
hair.
It has to be my hair then. Oh my god, I'm itchy. I'm sunburned, so like my boobs are itchy right now. That's what I get for sitting out in the sun for an hour.
You need sunscreen.
I had sunscreen
You need to
on.
reapply your sunscreen.
Oh my god, I got this lecture earlier at lunch. I did. No, I didn't reapply.
You get
but
this
we
lecture from me frequently because you're like, oh, bro, I'm not as pale as you. I don't need to.
weren't-
I told you, I reapply sunscreen every hour, and everybody makes
I
fun
was
of
only
me.
out there for an hour.
Well, you should have reapplied it.
Get this lecture twice today. Rude.
Well,
All right, let's
that's
try
like
drinking this again.
so you can spill it all over the
Don't make
place.
me laugh.
Did you successfully drink and swallow from the can?
I did.
Perfect.
Just from the tip, though.
Always just from the tip. Always a hands down winner in Cards Against Humanity.
Just the tip. It really is. We proved that over the weekend. You're welcome. All right, what else?
Are we going? Okay. Would you rather have a patient scream at you for something that's not your fault or cry on you for something that is?
Oh. Cry on me for something that is. Only because it probably really isn't my fault. I'm just kidding. Because I'm perfect in every way. No, I'm kidding.
Obviously. That's why.
No, because I'm the type of person that, like, if I screwed something up, please tell me. So that
All
I
right,
can
let me get the list out.
Let me count the reasons why. Which is fine. Because I know I'm not perfect. I fuck up a lot. Ask my kid. Huh?
He's like, what? Huh? Because he drops his bottle. Would you rather chart for 3 hours straight with the new system
Oh, God.
or deal with one demanding patient's family member for 30 minutes?
Is a family member in the medical field?
Yes. But not emergency medicine. Something completely unrelated.
Like what, psychiatry?
No, because even that gets like something ridiculous.
A PhD in botany?
Sure.
Who thinks that giving the 98-year-old T&K is a good idea? I had one of those.
Yes.
You know what? 30 minutes. I can do anything for 30 minutes. Wait,
Yeah.
hold on. Do I have to complete the charting in 3 hours, or do I just have to pretend like I'm charting for 3 hours?
No, you have to actually chart for 3
Oh,
hours.
no, 30 minutes. I can do anything for 30
What about
minutes.
2 hours?
I can do anything for 30 minutes. Give me the demanding 30-minute patient, because the more
Back to the compassion fatigue.
I'll take 30 minutes any day.
What if it's 30 minutes every 6 hours?
That's fine. Because it's
Or
only once every
one-
6 hours.
Or 1 3-hour charting. So really, it's an hour of dealing with it.
That's fine.
All right.
1 hour out of a 12-hour shift, done.
All right.
Because that means, never mind. That means an hour that I don't have to deal with somebody who wants a turkey sandwich and
What if it's
Payments.
uninterrupted charting? I think that's the difference. Uninterrupted charting. You just get to focus on charting.
no, I can't do that because I can't just focus on that. The ADHD that I don't have kicks in.
Undiagnosed.
The
But I'm pretty
undiagnosed
sure.
ADHD, I would like put my phone out and be like, "Yep, let's post to social media."
Yeah, that would totally happen.
Yeah, you
But
too.
also-
So I don't want to hear
Also,
it.
never do we get a chance to uninterrupt
Uninterrupted.
charting.
I wonder how many charts I have that. I don't want to know. I just don't.
I
don't
looked at the
wanna know.
outlier list the other day. I almost just went and started fixing yours.
My name shouldn't be on that.
Yeah, they are. There's like 4 of them.
For what?
The
genuine.
discharge
Okay.
patient left time.
That wasn't. That one is. Oh no, that one.
Yeah.
Well, because I've had the last few times I've had registration, like they leave without being registered,
Yeah.
so I can't take them off
And then,
completely.
yeah, no, I had that. That's actually the reason I went and looked at it. It's
Mm.
because I had that happen a couple times, and
I had that happen like 3 times in one shift, and I'm like, well,
That's
they were
probably
here for
all
two
the
and a
ones
half
that are
hours.
there.
Probably. I'm like, well, they're here for 2.5 hours. They could have gotten registered. Different story. Go on.
that's a whole different topic there. I feel like we do this one all the time.
What's that?
Would you rather explain to a patient that they don't need an MRI anytime you come to the ER, or I'll try this one, or argue with a doctor that they do actually, or that we actually think they need an MRI? Because I had that happen. I had to fight for my patient.
The quadaquinus or whatever it's called. How the
that
hell
they
do you?
needed. Oh, wow. I read. I don't.
Okay.
Yeah. I had to argue with the doctor that this patient needs an MRI. The MRI tech was here and was ready to do it. He's like, I'll do it. I'm here. It's a holiday. This was not yesterday.
Oh, that's why it was a holiday.
No, and he was like, I'm here. I just did 2 others. This one is going to need one. Let's do it. And they were like, no, we would rather just admit her and make her wait for tomorrow.
Yes, because they want the
Why?
money. Because we work for a for-profit hospital. That's why.
But the doctor doesn't. He's getting paid the same amount whether he admits them or
So
not.
are we.
Yeah, so I'm going to fight for my patient when I need to.
Good for you.
I'm a better person than you.
I know. Oh no. I would argue with the doctor just to argue with the doctor because that's who I am, and they
That's
expect it
just
of me.
how we all know.
They expect it of me at this point. It's when I go to him, I was like, "Hey, genuine question." They're like, "Oh, you have a question and not okay." Like, yeah, believe it or not.
My favorite is, I'm actually trying to learn.
Right?
So when I
So-
ask this and it comes out kind of bitchy,
Bitchy.
it's because I'm learning.
Genuinely curious at this one.
And why are we doing this? What's your reason?
Right?
Also, is it a good one? It better be a good one.
It better be a good one. It's normally not. No, there's a
Yeah.
couple times where it is. There's been a couple of times.
Would you rather clean up projectile vomit or explosive diarrhea without PPE or peppermint?
Well, seeing as I've done both the last 2 shifts, we had, oh my God.
I'm sorry.
Yeah. Labetalol overdoses, man.
I think I'd rather vomit.
Oh, I don't
As long as it's not bloody vomit.
Oh,
We should put a disclaimer on gross. This topic may be
it's
gross.
trigger warning. It's
Trigger
disgusting.
warnings.
Oh, that's. Oh, God. Vomit. Probably vomit. Because you can't get that on the wall and halfway up the ceiling.
Oh, yes, you can.
Well, I mean, you can, but you'd expect it more that way as opposed to it coming out of somebody's ass.
Valid. All right. Would you rather? I'm going to change this one. Too. Would you rather be floated to med surge or be charge nurse with 3 new grads only?
Charge nurse with 3 new grads.
And
I've
it's a
worked
chaotic shift.
I've worked inpatient before, and no, because it was inpatient trauma, and I absolutely genuinely loved it, and I would go back in a heartbeat if it wasn't overnights, because they don't have mid shifts, and I'm not a morning person, and I can't do overnights anymore. So my 12 to 12 is great, and I genuinely loved it, but it wasn't med surge, but it was inpatient, and I absolutely loved it. But I've also been charged where it was a total shit show. We were short staffed, and I had nothing but new grads.
And patients keep coding. I'm going to add to this. Patients
Yeah.
are trying to DC
I had
to
2
JC.
STEMIs.
And you have dumb nurses. Dumb new
I
grads.
don't know. It was a STEMI and a TNK. Oh, and they're dumb?
Yeah.
Send me to the inpatient. Send me to inpatient.
Just keep pushing until I find that line.
Until you find the line.
Yeah, no. It's one thing to have like the new grads, like the ones that we've had. That's different because
Yeah.
they actually have a brain.
Most of them. Some of them. Okay, a couple of them.
Thank you for hiring those ones, Tommy.
Thanks. Appreciate you. Would you rather work a double shift on Christmas or a single full moon shift on Friday the 13th?
You know, I legitimately have a friend who told me that the whole full moon thing has been statistically proven incorrect.
Yeah, I saw that study too, and
I call bullshit. So I'm gonna
I'm still
do
very superstitious.
wait, like a double, like work 16 because we work 12-hour shifts. So I'm gonna assume this is 2 8-hour shifts on Christmas.
Let's do
Or is it a full 24?
because
those aren't legal.
Hard to do, yeah. All right, let's say it's a 12-hour shift on Christmas and the day after, which the day after holidays are always the worst.
God, they're horrible.
And the day after Christmas is really bad because people hold on enough to get through Christmas and then they code and die.
Granny powers through Christmas.
Or a single full moon Friday the 13th shift.
You know what? Give me the Friday the 13th single full moon.
Same. Also, I have this theory that it's actually the day before and the day after the full moon. It's just like holidays.
Like
It's the day
3
before and the
days.
day after that
Yeah.
are actually
They're
the worst.
Horrible. Oh my God. And then you look down, you're like, yep, it's a full moon. That explains everything right now. Would you rather?
Go to the gross and gruesome section.
No. Would you rather? Granny with a UTI who's boarding in the ER?
Mm-hmm. Like altered mental Hulk status?
Yes.
Okay. Or
Or drunken angry patient who we have to wait for MTF.
can I help them not be angry? Sometimes you can get drunks to
No.
not be angry. They're just drunk and
They're
angry.
just drunk and angry.
Granny with a UTI. Even if they're hulking out, 100%. At some point in time, they will turn to you and go with your hand on, good girl, you're so good. Thank you so much.
Dementia granny with a UTI who's hulking out.
Still have Granny with
Even
UTI.
even though they're boarding?
Yeah,
Really? Wow.
yeah. Because I'll give you a whole bunch of antibiotics and fluid, and I will clean up your pee and make sure you're clean all
To where
day.
you just have dementia?
To where you just have dementia. Yep.
Okay, that's fair.
You can be just dementia hulking out, and I will still pick a Granny over drunk angry.
Oh god. Yeah.
Yeah.
Yeah, I would too.
Yeah.
I would too.
100%.
Actually. I loved my dementia patients. Like when I worked hospice, they are so much better when they're in their own home. So much better.
Yeah. Well, I think that's
The hospital terrifies them.
yeah. We've had a big switch from being the doctor's going to the home and assessing at the home to and everybody's go to the hospital. You go to the hospital, see the doctor.
God
Bring
bless.
back home.
I actually have a friend. Actually, a friend of mine. He's in the process of doing that.
I mean, that's
I'm
kind of my
like-
PRN job.
Really?
Mm-hmm.
We should do that.
That's great. And they're always more appreciative. Like they're genuinely appreciative when
They're
you go. and
nice
help
when
them.
you go
Yeah.
and help them to their house. Because
Like,
I mean,
I
you
didn't
don't want to
have to
go
go.
out in public when you feel like crap.
Yeah. No, I don't even want to do anything when I
don't
feel
want
like crap.
life when I feel like crap.
Right.
But yeah, bring back home visits. I fully support this. Oh God, you're already laughing. What do we got?
I just like mix the two of these together.
That's mean. Okay, do it.
All right. Would you rather have a patient with explosive GI issues and smells like they bathe in Axe,
Oh God.
or restrain a combative patient and dodge their vomit while inserting an NG tube?
Oh my God. Both of them want to make me vomit.
I know.
But once you
That's
put the
what I was
NG tube in, they
giggling.
don't vomit.
Yeah, but they're combative.
They're restrained if you restrain them well enough.
But you have to
They don't
restrain them
move.
first. And you can't call additional resources besides a tech that we don't have.
Do I have blow darts?
No.
I'll just blow dart them with something.
There's no ketamine blow darts.
Damn it. Oh yeah, you have to have a doctor's license for that or something. I'm just kidding.
You have to get a good ketamine blow dart first.
I'm sure one of the doctors has them.
I'm sure we can figure some.
We can figure this out. Oh God. Well, then that leaves me with no choice but with the other one, the GI guy.
Your explosive GI issues who's bathed in Axe.
Yeah.
That's why I wear a mask all the time.
I gotta start doing.
And the facial expressions.
Mine's all in my eyes though.
Yeah, I know. But if you wear a mask, it only covers half of the problem.
That's fair. All right. What else we got?
I know my answer to this because I feel like half of it is just really weird. But would you rather have a patient just walk in and bam, show you a rash on their genitals, or make you look at their phone with a picture of it?
I'd rather have them make me look at their phone.
Really?
Yeah.
No. Why are you
Yeah.
taking gross pictures?
I don't care. Not my
Just
problem.
let me see, because I'm going to need to look at it in real time anyway. 'Cause
No.
who knows when you took that actual picture?
I mean, well, that's part of your assessment. You'd ask me, like, look, when did you take this?
Yeah, and they're like 3 days ago. It's gotten
Oh,
worse.
God,
You're
that's
still going to have to look
different.
at
Oh,
it.
yeah,
Either way. Oh, I guess as a nurse, you don't
But you
have
can
to
mentally
be like,
prepare as opposed to,
"Doctor."
hey, look, this is what's wrong. And be like, all right, well, let's take a
It's
look.
like unsolicited dick pics.
See, nobody likes those. Nobody needs those.
No, nobody wants those. Don't
Nobody
do
wants
them.
Don't do that.
No.
Don't do that.
At least wait for them to be solicited. But females don't really go, I would really, you know what I would really like right now? I
A
could
picture.
use Joe Schmo's picture. No, we don't ever think like that.
Speak
No,
for
send us
yourself.
some
No, I'm kidding.
chicken minis. Love
Right?
language. Clearly, I'm getting hungry.
We'll go have dinner after this. I'll go feed the children after this.
Would you rather deal with someone who Googled every symptom and knows what's
Christ.
obviously wrong with them, cancer, or someone who is clearly very sick but
You gotta let me
insists
finish
they
swallowing first.
swallow faster, or someone who never gets sick and has no medical history but then has a list of 18,000 meds?
Oh, I'd rather have the second one.
The one who never gets sick.
The one who never gets sick, but then has
yeah.
has no medical history.
I'm with you there.
Because they're about to code any minute.
I don't care if people think I'm a doctor. I always correct them. No, I'm better. I'm the one who actually listens and makes you understand
I'm
things.
the one who actually listens. People always call me doctor too, and I'm like, no.
Don't want that debt there, thank you.
That and like, I don't. Oh God, going to med school. I have a friend who
Yeah.
tried to convince me to go to med school. I'm like, no, you've lost your mind.
Absolutely not. Although I will say, the one who keeps calling you sweetie, if they're old, like the old grannies, I don't mind if you call me sweetie. But there's some creepers who just always call you sweetie.
I had one
every
call
time
me
they
babe.
come in.
He kept calling me baby. I was like, I'm not your baby.
No.
He was
that
like
creeps
50
me
some
out.
years old. I was like, I'm not your baby. I was like, my name is Stephanie, and you can call me that.
My name is Stephanie. I'm your nurse, not your
It was
doctor.
the family
Don't call
member.
me baby. Oh, that's
That's even worse.
Yeah, no, that's an ick.
That's when I was like, oh, God, there are only two people in this world who can call me babe and baby. And one of them brought me into this world.
Would you rather deal
The
with a
other one's
patient
gay.
faking the symptoms for meds? faking symptoms for meds, or refuses pain meds because they don't believe in them, but they come back all the time, and you know pain meds would fix them, and not drug seeking, like fix them.
Depends. Am I irritable that day? Because if so, then like give me the patient who doesn't want the meds, because I will unleash
You
And-
can't unleash. We have to get good patient satisfaction scores.
I'm leaving in a month.
Also, don't mind my.
You're eating.
My
I'm sorry.
eating.
I'm starving. I'm starving her.
Mm-hmm. Clearly, I am a starved child.
I'm starving my child. In all seriousness, no, I would not actually unleash. I would use it as a PC
Educational
moment.
opportunity. We don't unleash. We educate.
Very aggressively sometimes.
Sometimes people need a
sarcastically.
little tough love.
Yeah.
Mhm.
Yeah. That's not fair. You're getting you get to read them before I do.
Well, it's open and up. You could very
Oh.
easily read them.
No.
Would you rather get yelled at by a patient's family or publicly corrected by a surgeon? 100%.
I had that
Patient's
hap-
family can yell at me all the time.
They
whatever.
can, yeah, they can yell at me. I really don't care. One of the APPs actually got like scolded.
Who's messing with my APPs?
Oh, I'll talk to you about that one
Back
off camera. But like,
We'll make
the
fun
surgeon
of them.
came,
I'll back you up no matter what.
right? Oh, you would too.
100%. For those listening, I'm throwing up fists.
Like flat out in front of the patient and be like, well, this is why we don't need to do this, 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 and this. And then they had complications and it made it worse.
Yeah.
And I kind of wanted to be like, what were you saying about that?
I would have. Sometimes it's just got to come out.
I didn't see them
Especially
since.
surgeons.
I hadn't seen them since.
Surgeons need to be put in their place sometimes.
This is true. I did that one time to one of the trauma docs.
Put them in their place.
Put them in their place. And it was funny because like all of the nurses on the unit they'd never worked in the ER. They were all straight from nursing school to inpatient.
Yeah, because that's what they tell you you have to do.
And
It's not true. You
they
don't
were
have to.
all like, because it was in the middle of rounding. And I'm like, I can't remember what he said. And I snarked back at him and he goes, what'd you say? And I was like, yeah, you heard me. I know you did. I said, if you think it's okay for you to talk to the nurses that way, then it's okay for us to talk to you that way as well. I said, or we can
All right.
keep a level of professionalism. It's up to you.
I feel like sometimes that's valid. That's why I do like our hospital, because most of the time,
They're chill.
most of them are all about the team,
Yeah.
like team medical aspect. Like,
Yeah.
understand if I come, hey, I really feel strongly about this patient being a sepsis. And if I come to you saying they're
If
going to be
I
a
come to
sepsis,
you, yeah.
you know,
And I think
I'm
the-
going to be doing
yeah.
extra work because I'm telling you this,
Then there's a problem.
then you know.
Like if I'm saying, hey, I need a doc in here now, odds are that patient's about to die.
They're trying to
Or
DC to
They're
JC.
trying to DC to JC or something's really not okay. Because I don't call the docs in just to do it.
Or like
Just
they-
because an MD
like-
aware, I can have that conversation with them at the desk.
MD aware, yeah. That's my favorite phrase.
Who was it? One of the docs does that. She goes, just an RN aware moment. I said, noted.
Noted. RN noted.
Ooh, would you rather?
Remove 10 ticks from someone's groin. I'm out.
Nope,
Ticks.
out.
Done.
Done.
Unclog a catheter on a decomposing toe patient.
What kind of catheter would have it?
Like a, I don't know, like a wound vac kind of?
Oh, give me the
Think
wound
about
vacs all day, every day. It's like arts and crafts time. Because you got to cut the foam
I'm-
to the
I'm
right spot.
It could be one tick. I'm done.
Nope,
Ugh.
done. Bugs are gross.
And it's tick season again. We've had so many.
that is,
Nope, I'm out. Actually, today's studying was all about, the skin stuff. And there's a good several pages on tick. And I'm like, nope, skip that. Done. I don't
Did
need to
you
know
know
about
that
that.
a
I'll
lot
fail
of-
that in class.
a lot of the tick testing, like the tick-borne illness testing, like blood tests, are actually not accurate,
Uh-huh.
like for Lyme disease.
Yep.
Yeah, I didn't know that until Mason went through it.
And it's crazy because it takes, where is he?
He's probably in the bathroom.
Oh, I was like, your small human disappeared.
He comes and goes from this place. He knows where everything is. Yeah, when he was going through like all his Lyme disease stuff, they couldn't diagnose what was going on. We had to go through a special lab that was not even in the States. They were based out of Canada to get his testing for Lyme disease because like the standard, we had the standard blood test that we just run here in the States and that
Yeah.
came back negative. But I was like, no, there is something going on. And so we got the other one. And yeah, it's because the protein that is in the Lyme disease, in the Lyme vaccine they kept getting a lot of false positives. So they took that protein to test that protein out of the testing.
Mm-hmm.
So now a bunch of them come back negative, even though it's positive.
Interesting.
Yeah, I was pissed because he
Yeah.
went like 3 months of like, we didn't realize what was making him so sick. Yep. Till we finally figured it out.
Baby.
I know.
When he walks back in, I'm like, Mace, poor baby.
He had it was bad because he's got a dairy intolerance anyway, but it made it to where he was like full
no
on
milkshakes for him?
allergic. He can handle like a milkshake like
So
a
no
week.
constant milkshakes.
No
for him?
constant milkshakes, but
Sorry,
he knows
can't
he
bring
won't
any.
do it.
Can't bring any boys to his yard.
But no, and he was getting sick like dairy, like he like developed a full on allergy to dairy. So we had to go dairy free for about 6 months. And I handed him over to the NIH and I said, here, because he did some experimental treatment.
He needs his cheese.
No, it was an experimental. No, because apparently Lyme disease, like if it like advances and you don't get it treated, it can actually cause like a lot of psychological
up to a 30% mortality rate. I
Yeah.
read that today. I did read that section of my studying.
That's crazy.
And a lot of the symptoms, like people don't even realize, are like
Lyme
Lyme
related. Yeah. Yep. No, they did an experimental thing on him, so he didn't have to do I did. I was like, here, we'll try this, but he didn't have to take any antibiotics for it. It's an inhalant. It's like a neb treatment
Oh.
thing.
Interesting.
Yep. We'll have to go to down a whole Lyme disease thing.
Yeah.
Because there was a lot. It was very involved. It was a lot.
See, that goes
It was
back
a lot
to
of testing.
advocating for
retesting.
yourself
Yep.
or your tiny human.
Yep.
That's a whole topic we're going to get into one day.
Family members in the medical field. Nurses make the worst patients.
Uh-huh.
They make the worst family members, especially when it's their children.
And we delay going in when it's us till way longer than we should.
Feel attacked. I have voluntarily gone to the ER twice.
I've voluntarily gone to the ER twice. Should I have gone much sooner?
It's because you
Yes.
go into SVT.
No, I don't. Now I'm feeling what? What's up, Mace? Hi.
All right, back to Would You Rather. Our squirrels got off their tracks again.
I'm running out here.
Let's see here. Would you rather have Mexican or Korean barbecue tonight?
Oh, Korean barbecue. Mace has Korean barbecue sound.
You want Korean barbecue?
You,
Well, they have
have-
steak.
It's
there.
meat.
Yes, you can have steak.
You can have meat. Here?
That. And you
What
have
did
to
you
have local provisions.
Oh.
Okay, I'm not
I'm
paying
just-
$300 for.
That's
the
it.
three
He
of us
just
to eat right
wants all of the
now. He
food.
just wants steak right now.
Yep.
Okay,
Last one.
last one.
Would you rather have your DNR patient code on you when they're young and all the family is not ready for them to go and they're all there and extra dramatic?
Like I throw that in. Or
Extra emotional, not dramatic, emotional.
dramatitis.
Yes. Or accidentally call a rapid on someone who's sleeping and it's your favorite team who responds to it. And so they
I would do it just to
all
fuck with them.
know. Seriously. not just to,
I
not
would do it just to
mess
fuck with them, dude. Hell yeah, call the rapid. Stand outside the door and be like, hey guys. Just kidding.
No, you can't do that. You have to let them think that you are dumb. Called it on a sleeping person.
They would,
That
honestly,
you legit
though,
meant.
honestly, they would probably be like, are you okay? Like, they would probably call a stroke alert on me.
They'd probably
thought I did
throw
that.
you in the mental health ward. Be like, she's lost it.
That's, like,
She's
again, it's sounding
bonkers.
like a great 3-day vacation.
Yeah, I tried. But then you have to be upstairs.
A 3-day vacation. Oh, wait. Who are the patients? Are they the ones that are always here?
Yes.
No, I'm out.
Upstairs. Dun, dun, dun.
Duh, duh, duh.
All right, I'm out. I'm done. I'm ready for food. We hope you enjoyed this 3.25 mini.
You know what?
Episode.
Screw it. Bye, guys. We're hungry.